I hope you take my insurance. There's just so many times that I read on our page, that I hear it from the phone calls that say, do you take my insurance? I hope you take my insurance. I want to come and see you. Do you still take my insurance? You know, I want to tell you a little story. I've been in practice for about 20 years. When I first started, we had an office that participated with all dental insurances. As we evolved in our practice and we invested in making the best practice that we can have, having the best team that we can have, we decided that participating with dental insurances just wasn't in the best interest of our patients. So we decided to not be on any of the insurance panels, and we still submit insurances for patients and help them get the most out of their benefits. But some of the patients didn't listen to us, and I get it. They decided to go whoever was quote unquote on their insurance. Fast forward 10, 15 years, the other day I had a patient come back and see me. He said to me, I want to be your patient again. And I said, what happened? He goes, well, I have a loose tooth. I said, great, no problem, take a look and see what's going on. And keep in mind, we don't always get to be lucky enough to see what it looked like 10 years ago to what it looked like today. I don't know if the word shocked, but more importantly, I felt so sad. And I felt sad maybe for the patient, or maybe I just felt sad for the situation. It was apparent to me that every single year, he had some dentistry done at the insurance office. It was almost like to the point that it was maxed out every year. That $1,500 of dentistry was done just enough, not too much, not too little, just that $1,500 done. So if you think 10, 15 years that he had this done, he spent almost $20,000 of insurance money on his mouth. Problem is that when you do piecemeal dentistry, it sort of falls apart. Maybe you overtreat, maybe you don't diagnose correctly, but his mouth today is not in a good position. It needs a lot of reconstructive work, and this is not someone who's neglected his work, neglected his mouth. He's gone to the dentist, he's trusted the dentist, but he left our practice. The result was just almost devastating to me, and I felt so sad for him because he was my patient and ended up going somewhere else. So what do I say to people that say, I hope you take my insurance? Listen, dental insurance is not gonna pay for the dentistry that you need. And sometimes you don't need all the dentistry that you think you need. But when you neglect your mouth and you haven't been to the dentist in 10, 15 years, or you've been to the wrong dentist for a really long time and you've had a bad experience, it usually means that you're gonna need a lot of dentistry. Now, whether you have insurance or you don't, there's gonna be an out-of-pocket expense. It's just the system that we live in. So the question really you should ask yourself is, I hope I can be your patient. I hope that you can help me. I hope that you have a solution for me that will get me healthy, that will allow me to smile, and more importantly, that will allow me to stop worrying about my teeth. Because that's really all we want. We don't want you to take my insurance. You really just want to get the dentistry that you need. And not all dentists are the same, whether you do or don't take insurance, and not all treatment plans are the same, and unfortunately, not all diagnoses are the same, although they should be. Pick a dentist that allows you to have freedom from dentistry. That means you just have your teeth cleaned a couple months, a couple times a year, and get the dentistry that is definitive, that will fix your mouth, that will allow you to feel the way that you want to feel, that will allow you to smile the way that you feel, and the one that will allow you to eat what you want to eat. Stop shortchanging yourself. Don't be held in by what your insurance will cover. Find the dentist first. Find the one that you trust. Find the one that will give you what you need and what you want in a time-efficient manner, not over the years. We'll do one now, we'll do another one next year, another one the year after. It just, like I said in another video, it usually ends up to broken teeth, missing teeth, unhappy patients, patients that hate the dentist. Do the dentistry once and do it right, and then just maintain it. You can always come to us. We'll be happy to help you.